Hello everybody, I'm Dr. Yeap Chee Loong. I'm a consultant general surgeon in Gleneagles, Kuala Lumpur. Gallbladder is a structure in our body, in our tummy. If we point on my body, it's actually located on the right side, upper part of the right side of the body. If you look at this model, is actually here. Is a structure or organ in our body. The main function of gallbladder is to store the bile juice that is excreted from the liver. One of the main diseases of gallbladder is gallstone disease. The symptoms of this problem, number one, is mainly pain. The pain typically either will start from what we call the epigastric region, where the place I point here, and when it becomes severe, it can radiate or start to move to the right side of the upper abdomen. In the worst case scenario, when the disease gets worse, patient might develop fever, increasing pain, and sometimes they will develop what we call jaundice, where the skin become yellow and the eye become yellow as well. But for F as the risk factor for gallstone disease, the first one is fat, meaning that patients who are obese have higher risk of developing gallstone disease. Second one is when second F is 40, meaning that patient who is above 40 years old, chances of getting gallbladder stone is also much higher. Patient who are fair, meaning that patient who are Caucasian, they're from Western countries, risk of incidence of gallstone disease is also much higher. The last one is female, so women have slightly higher chance of developing gallstones disease. But over the years, things has evolved so much. So we are seeing more and more, even thinner person has almost equal chance of developing gallstone disease. Patients who are younger than 40 years old, I've seen and I've operated patients with gallstone who are as young as 16 years old. We are seeing more and more Asian patients with gallstone disease, and also we are seeing more and more men with gallstone disease. So in short, gallstone disease can be life-threatening if you don't deal with it properly. The short answer is no. So it means that stone will form again. So it doesn't help in treating this disease, because once a stone forms again, we are back to square one. Patients without gallbladder live their life normally. Their lifespan will not be affected. But having said that, there is about 5 to 10% of the patient might experience certain side effects after this kind of surgery. Number one is they might feel a bit uncomfortable, especially in the abdomen, especially when they eat fatty food and oily food. And again, the same amount of patient might also develop another new symptom where they might complain of diarrhea after this kind of surgery. And again, this only happens in 5 to 10% of the patient. Yes, robotic surgery to remove the gallbladder is definitely an option. The advantage of this surgery is it allows a surgeon to perform the surgery more accurately, very precise, and hopefully this will translate to better surgical outcome as well as faster patient recovery post-surgery. My take-home message here is that not everybody will have pain in the center of the abdomen will have what we call gastric or gastritis. There are many other causes as well, including gallstone disease, and this is treatable.